If you know someone on this medication, all of a sudden they're in eBay 5 times a day.
How high of a dose of Mirapex is beneficial?
4 or 5 milligrams often. So you'll definitely need to protect your stomach when you're getting up to that.
See, I take 2 of the 0.25.
Yes. That's certainly good for sleep and will help, but the doses Andy was using were 4 to 5 milligrams, and he gave people a trial of Prilosec, Prevacid to find out the best one to protect their stomach. Substance P modulators. Substance P is elevated in the central spinal fluid of patients with fibromyalgia. Merck brought out an antidepressant years ago to treat substance P in part. It was rejected. But there is a substance P inhibitor or modulator, and that's Zofran for nausea. Typically, it's only approved for patients with cancer of nausea, but I've seen some insurance groups approve it for patients without cancer. So it modulates substance P and definitely reduces pain in fibromyalgia patients. Guaifenesin. Is it real? Who knows? Paul Saint-Amand's a wonderful person. He has fibromyalgia himself. It's worked on him and his family. There's no study to date that demonstrates it works. That doesn't mean it doesn't work. If you decide to do that, you need to do it very slowly. You need to go to his website to avoid all the medications that can interfere with it. He's a really charismatic, very caring person out of UCLA. Vitamin D. Paul Saint-Amand. And he's got a website, and he's in the phone book. He's easy to find.
He also has books at the library.
Good. Okay. He's affiliated with UCLA. Vitamin D. Mayo Clinic did a study where they found out the majority of patients with chronic pain had vitamin D deficiencies. And it wasn't just the Northwest, where we're notorious for getting no sun. It was Alabama, Louisiana. They found that it may take 6 months, but if you treated patients with high-dose vitamin D, their pain and energy improved. So all of you should be tested for vitamin D levels, and if they're low, and some of them are 0 in some of my patients, some of them are 10, and you really would like to get it up to 50. So it may take 6 months. Definitely one of the things that's helped pain and energy. And then if you look at non-pharmacological treatment, these have been proven to work. If your favorite modality isn't up there, it doesn't mean it doesn't work. It means there are no comprehensive studies yet. And my feeling is really anything you think that will help you and won't hurt you, I'm in favor of. And many of us will also share patients with naturopaths who are good. So I think if what works for you isn't up there, it doesn't mean it doesn't work. It just means we have no data. And before the hook comes, I really want to thank you for listening. Any questions?
May we download this to our computers so that I can email this to everybody?
Yes, yes.
We're talking about the antidepressants. I just recently, in March, got diagnosed with bipolar disorder. They've taken me completely off the antidepressants. Do the mood stabilizers help in a way with fibromyalgia? I know the Neurontin seems to help a little bit.
Yes.
But not a whole lot.
So Neurontin actually can help, and it's dose dependent. So all the studies with Neurontin actually have shown efficacy with it, but the other mood stabilizers don't really seem to contribute. Yes?
Talk about low renal function.
Well, typically it's not part of fibromyalgia. So if you do have reduced renal function, it should be worked up and evaluated separately. Adrenal. There are some studies that show that adrenal insufficiency may contribute to it. There's something called an ACTH stimulation test. You fast overnight, cortisol level is done, and then you're giving an intramuscular injection. An hour later, you see if the cortisol level has bumped. So there are a group of patients, not everyone, but who could benefit from some cortisol. And that's a good question. Thank you.
I want to thank Dr. Brown for being here today. Dr. Holman does have a study running right now, and we have information about that out on the table. I was the first patient in the pregabalin studies in Seattle, the Lyrica studies, and that's one of the reasons that Pfizer is underwriting why we're here today and why the food is free, why the parking's free, why we're here in Glazer today. And so I really want to thank Pfizer for being here today. And thank you very much for being here today, Dr. Brown.